Hey everybody, Erin here with Engineering Radiance. I have a special guest on here today for one of our last interviews I'm doing for Migraine Awareness Month. So hope you find this helpful. We're going to talk about hormones and migraines with our special guest, Dr. Cheryl Winter, who's written some great articles that we're going to share with you, but we thought we'd come on and have a conversation and kind of summarize some of the main points and answer your questions too. So if you're listening, definitely let us know what questions you have and we'll try to address them here on the call. So thank you, Dr. Winter, for being here. Tell us a little bit about yourself and what got you interested in migraines and the link with hormones and migraines.
Oh, wow. Well, I started out in the healthcare industry like about 35 years ago. I started out as a hospital registered dietitian. And, I said enough is enough after 7 years. Believe it or not, I was passionately believed in the power of nutrition and helping people improve their disease state with food. But it became obvious to me that doctors didn't see me as I did, as an important member of the healthcare team. To them, I was just on par with the lady in the hospital cafeteria. And most of them just wanted me to, help them improve their food meal service. And so, even the patients, they didn't want to be victims of dietary deprivation because we were back then, it was the era, it was the start of big pharma. And so the patients were just so excited to be able to take a pill for every ill. And so, I couldn't change the system. And so the system changed me. And I started a different career path that led me to become a legalized drug dealer.
Okay.
Because at that time, I couldn't beat them. So I joined them. But then it didn't take me long to realize that my drugs were actually making people sicker.
Mm-hmm.
So I tore up my prescription pad and I became a real doctor. I went back to school. I got my doctorate of clinical nutrition. And, food is medicine. It is the real medicine. And so my career has kind of come full circle. And so right now I prescribe bioidentical hormones. I do not prescribe drugs. We don't have a deficiency of drugs in our body. We don't have a deficiency of metformin or Lipitor or Prozac, but we do have deficiencies of hormones for a variety of reasons. So I do prescribe bioidentical hormones, not synthetic, the ones that are identical to what our own body makes. Mm-hmm. And so, when it comes to headaches, we know that about 80% are due to hormonal imbalance. And then once you correct this hormonal imbalance, headaches can then go away.
So you found this to be really effective. The bioidentical hormones has been effective for people with coming in with hormonal migraines and things like that?
Yes, definitely. So it's not just, my first choice is always nutrition. So I'm going to first work that way by using food and improving the hormones in that regards. But sometimes you just can't. And so, women have to understand that you can have hormone problems pretty much at any age. You don't have to wait till menopause to be having hormone problems.
Or for your hormonal migraines to go away. That's something that always just irks me, as if people have, cyclical migraines and things like that. And they're like, oh yeah, someday they'll go away when I hit menopause. I'm like, don't wait. We can do things. No. So what are some things people could think about nutritionally? Because that's something everybody can start doing right away. What can people do with their food that might affect estrogen or other hormones and help establish some balance?
Oh, well, yeah. So, what triggers the migraines is it occurs mostly during a woman's ovulation period or menstrual period. So it's really not the fact that they don't have enough estrogen. It's just the fluctuation of it. And so sometimes we just have to, manage that a little bit better. I don't believe in I don't really like using birth control pills, but it seems like conventional medicine loves doing that. And so women who are sometimes using the pill pack, they will get migraines as well, because when they stop that pill that last week abruptly, then they can get a headache. But and what happens is, estrogen in the brain is in charge of serotonin transport. And so when serotonin, we know it as a neurotransmitter that when it's low, it's going to help us with postpartum depression or melancholy. And so since we know that estrogen affects serotonin, we can improve some serotonin by diet. We can improve that particular neurotransmitter with diet. So tryptophan, as you know, turns into serotonin. And so we want to eat more amino acid, more of the foods that have the amino acid tryptophan in it.
So what else would that be other than turkey? Everybody knows turkey. Yes. What else can we look at?
Well, there's avocado, there's pork, cottage cheese, wheat germ, and wild game. So also we have supplements, of course. But you got to be careful with supplements, especially for someone who might be taking other medications that have serotonin effect, like the triptans and Prozac and Zoloft. Those, you don't want to be taking supplements that are going to increase serotonin along with those, because then you can have a serotonin syndrome episode, and that wouldn't be good. But you can take tryptophan, you can take 5-HTP, L-theanine, which we have in green tea, matcha green tea. But other things I like to do is do a micronutrient test and find out what nutrients that are low that also affect the serotonin, which are things like vitamin C, vitamin D. So, magnesium, of course, and, some other supplements are like passion flower, inositol. I've tried those, and St. John's wort. So those are just a few of the supplements.
So that'll help boost the tryptophan. Is there anything else for estrogen changes and fluctuations that people could think about?
Oh, estrogen, absolutely. So the thing with estrogen, we have different estrogens. We have 3 different estrogens, and we want to make sure we have the right metabolites, and then we're detoxing the estrogen properly. And so, of course, sulfur vegetables are going to help us with detoxification: Brussels sprouts, cauliflower, kale. We want to be sure we're eating plenty of those.
What does plenty look like if somebody really wants to change the needle on their detoxification? How much broccoli and cauliflower exactly do we need to be eating?
Well, we don't want to be eating that. Obviously, we want to be eating from the family, not just one particular thing. But every meal we should have a vegetable at every single meal, and half our plate should consist of some good vegetables, green, yellow. So sadly,
and white onions.
Well, onions, yes.
Yeah.
So sadly, our diets are not adequate enough in vegetables, and we want to be making sure that they're clean vegetables. Not full of glyphosate and other pesticides. So
good. Okay, so we talked about tryptophan, estrogen. Is there one more hormone that you think that's especially important for people to know about or think about?
Yeah, so we were thinking, when I was talking about that, we're thinking a low estrogen that's doing that. But then we have the high estrogen, or another name for that is estrogen dominance, which is also the same thing as a progesterone deficiency. And so the brain is, also highly responsive to progesterone. And actually, our brain has 20 times the higher amount of progesterone than the blood does. And progesterone is a calming hormone. And you can become deficient in it as a result of stress. We have the cortisol that steals that progesterone. And just, young women who've just had babies can have less production of progesterone as well. And this can trigger migraines, just a lack of progesterone. This leads to insomnia, which then, causes problems with detoxification, and then you've got more buildup of estrogen. So it's kind of a vicious cycle.
A vicious cycle. So that's an area where you would do like hormone replacement therapy for progesterone, or is again there's some foods that you could use to boost?
Yeah. So I definitely think people need to get their progesterone balanced. It can make a difference between everything and how they feel. It works as a natural anti-anxiety drug. It helps improve the Gaba, which is also a neurotransmitter. And so when we're trying to eliminate headaches and improve rest, we do want more Gaba. And progesterone helps improve that. Now, there are ways we can get Gaba through food, similarly to the serotonin. There's supplements. Oh, of course, there's food first. That's always the first thing. But, almonds, get Gaba that way. Bananas, spinach, oats, liver, halibut, oranges, potatoes, lentils, and broccoli, wheat rice, or whole wheat rice. But supplements for Gaba that are going to help with the progesterone as well is the magnolia bark, inositol again, magnesium again, passion flower, a lot of the similar ones actually. So, and of course, the exercise is going to help with both of those.
I like how you're tying in the neurotransmitters with the hormones. I haven't heard somebody talk about that as much before.
Yeah.
If anybody has any questions here, let us know. Otherwise, I want to make sure to point you to we've only kind of scratched the surface.
Yeah.
And I want to point you to Dr. Cheryl's website, which is drcherylwinter.com. And she has a really good blog post about how hormonal imbalances can trigger migraines. And then a lot of what we talked about and more with foods and different things you can actually do to get after that. So this is a good blog post. I highly encourage you to read it. So I'm going to put that as a comment for this post. Is there anything else, with Migraine Awareness Month this month, anything that you really want migraineurs to be aware of? Any exceptional thoughts that you want to share?
I just want them to know they don't have to suffer. We need to look for the root cause, and oftentimes it is an imbalance in hormones, and we can correct it through food first. And if that's still a problem, there's bioidentical hormones. We haven't even touched the surface with thyroid and testosterone yet, but those are big ones too that are often very imbalanced in young women as well as older.
Yeah, absolutely. Biggest thing is just to know that hormonal migraines aren't the end of the story. That's the beginning of the story. That's the clue that
Exactly.
There's something else that can be done, and the beginning of your investigation. So thank you so much for being my guest. You're a great educator. I can hopefully we'll be hearing more from you in the future. And you'll keep putting out these great articles and sharing with us. So thank you very much for today. Yeah, we'll talk soon. Bye.
Bye.